Hey, let's talk for a few minutes about how the Medicare Part D creditable coverage calculations actually work. And here's the spoiler. Employers won't really be able to do this on their own starting in 2027. So CMS in 2026 gives employers two simplified ways to determine if their Medicare Part D prescription drug coverage or if their prescription drug coverage is creditable against Medicare Part D. The existing simplified method and the revised simplified method. So for 2026, the employer can choose either option. Starting in 2027, they have to use the revised simplified method. Now, on paper, they're meant to make the process easier. In reality, they're almost impossible, or at least the revised simplified method is almost impossible for employers to use without carrier or actuarial support. So in 2026, employers can still use the existing simplified method, which allows a plan to be deemed creditable if it meets four requirements. Number one, it covers brand name and generic drugs. Number two, it provides reasonable access to retail pharmacies. Number three, it's designed to pay at least 60% of the expected prescription drug costs. And number four, it has no restrictive annual or lifetime limits on drug coverage. For example, there can't be a $25,000 annual max on the benefit. So for example, let's say that a PPO plan with a three-tier formulary, three-tier copay structure of $10, $30, or $60 has no annual prescription maximum, has broad retail access. It would typically pass this test. A high deductible health plan with prescriptions subject to the deductible might fail unless the deductible is low enough or preventive generics are carved out of the coverage. So in reality, under the current or old method, most copay plans and some high deductible HSA qualified plans would be considered creditable. Now, for 2026, this new revised simplified method is being phased in, and it will be required for 2027. The reason it's introduced is to reflect the richer Medicare Part D standard benefit after the Inflation Reduction Act. CMS basically raised the bar here. So the revised method requires coverage of brand and generic drugs, including biologics, those specialty drugs, reasonable pharmacy access, and a plan design that's expected to pay at least 72% of participants' drug costs on average. So looking at the math here, the plan value percentage to determine if it hits at 72%, you look at the total amount that the plan paid for prescription drug claims and divide that by the total prescription drug claims, the amount that the plan paid plus the amount that the member paid. If the result is 72% or greater, then the plan is creditable. If it's less than 72%, then it is not creditable unless a full actuarial equivalence test proves otherwise. So to kind of give you an example here, let's say that claims data shows that $1 million was the total allowed prescription charges, and the plan paid $740,000 of that million. Members paid the remaining $260,000. So you would take the $740,000 that the plan paid divided by the $1 million total. That's the amount the plan plus the members paid. The math here is easy. It's 74%, so it would be considered creditable in this case. So looking ahead, the math may look simple, but in practice, employers don't have the data or the tools to run these tests on their own. Basically, carriers or actuaries must provide the determination, while employers will remain responsible for the notices that go out to employees and for the reports that have to be filed with CMS. So going forward, starting in 2027, staying compliant will require a partnership between the employers and the health plans or the carriers, and proactive planning.